This is One on One. Hi, I'm Steve Adubato. We're here at the Hyatt in New Brunswick, New Jersey. This is a forum, a day that recognizes the 50th anniversary of the Community and Mental Health Act of 1963, signed by then President John F. Kennedy. We're here with a group of leaders, experts, advocates who are part of this community, who have been working in this community, and one of them is Dr. Ruth Perry, who is the Executive Director of the Trenton Health Team. And you've been at this for several years, Doctor. First of all, describe what the team is and how it's connected to the effort to deal with those who are dealing with mental health issues.
Absolutely. The Trenton Health Team is a community-based health improvement collaborative that's formed with St. Francis Hospital, Capital Health, Henry J. Austin, our federally qualified health center, and the City of Trenton Department of Health. And so we've been in existence officially since February of 2010. We're a 501c3 nonprofit organization, and we're working on several strategic initiatives, which include access to care, community-wide clinical care coordination, engaging the community, expanding our infrastructure to become an accountable care organization for Medicaid population, and to use data to improve population health as well as individual health. And so we have a lot of interface with the mental health community. Many of our patients have complex medical, but psychological and social needs. And so part of our community collaborative with the 4 corporate partners involves about 33 total community partners, many of which are behavioral health specialists, homeless professionals, and we work together to solve one at a time very complex problems for our patients that have medical, homeless issues as well as behavioral health issues.
Dr. Perry, an event like this, so many of your colleagues come together from different related fields. But why is it important? Why is it significant to recognize the 50th anniversary of this Act, 1963, the Community Mental Health Act? For folks who don't understand what was pre-63, President Kennedy signing that legislation, and after, even though we have a long way to go, what changed with that law?
That's a great question, and I think it's a huge issue. I think it's significant that we take the time to celebrate the successes that we've had since President Kennedy launched that act back in 1963. He gave tremendous visibility to the issues of the mentally ill as well as those with developmental and physical disabilities, and talked about how they were institutionalized, how they were stigmatized, how they had received poor care, how they were abused in the institution, and that we really could do a better job. And since his sister had challenges, he had a personal connection. So he used the power of his office plus his personal family experience to provide visibility to this issue and to the conditions that were there, and actually challenge us to do a better job by providing care in the community. And so he catalyzed a huge change initiative that I feel is continuing, and we have done a lot, but we still have a long way to go. But what he did was huge, and that legacy lives on. And so that's something to celebrate, as well as to look at the gaps that we have and work together collaboratively to close those gaps for the patients.
You know, Dr. Perry, say people are thinking about Trenton, they think, oh, there's a crime problem, there's a problem with education, like a lot of urban communities. But they would not normally think, oh, so that has something to do with mental health? There's a housing problem, there's an education problem. The mental health issue is a thread throughout, correct?
Yes, it is. We have a lot of issues we call housing, the lack of insurance, the lack of economic opportunity and development, cultural issues, because Trenton, and as a lot of our other cities, are very, very diverse. All these issues come together around health, and we call these the social determinants of health. And so behavioral health is huge. So many individuals that were in institutions prior to 1963 with deinstitutionalization were released into the community. But as communities changed, because the 60s was a volatile time of a lot of social change, businesses left Trenton, people fled to the suburbs. And so now you have a concentration of individuals with little opportunity who are very poor, who were discharged from institutions or had family members and generations who were in this spiral of being institutionalized with behavioral health problems down in the community. They're homeless, they can't care for themselves. So this is all these areas are interconnected. And what we have found within Trenton that the number one cause of emergency room visits over the last several years have been behavioral health issues and substance abuse issues, followed by sickle cell disease, pain crisis. Many of these individuals are also homeless. So unless we can address holistically the medical, the psychological, and the social, individuals and patients will not have an improvement in their quality of life, and we will have continuing escalating costs for care that are not appropriate. Clearly, we need emergency rooms, we need hospitals. I'm not saying that we need to get rid of them, but there's certain things that are better treated in the community, better treated in a primary care setting versus an emergency department.
Doctor, what would you say to those watching on public television who say, that's not really my issue because I don't live in Trenton, I don't live in Newark, I don't live in Camden, I'm not in New Brunswick, I'm not in an urban area, so that's not my issue. You say?
I would say that it is our issue. We conducted a community health needs assessment within the city of Trenton as well as within Mercer County as a whole, and there were some areas that were different, but there were several areas where there was overlap between the city and the county. And
focus that on, sorry for interrupting, but focus that in terms of mental health. How is the mental health issue everyone's issue?
Mental health is an issue because it was identified in the county as a significant problem as well as in Trenton.
How so?
A lot of individuals have mental health issues that may not be diagnosed. It's not uncommon for individuals to suffer from depression along with other medical illnesses. Doctors have not been the greatest in diagnosing mental health issues. They have not always been comfortable in doing that. They may not ask questions. They may feel very uncomfortable with that. So there's a significant number of individuals across race, ethnicity, socioeconomic level that are suffering from mental health problems. So it is all our problem. It may manifest itself in different ways, but the underlying issue is mental health, and it affects us all.
Finally, as we recognize the 50th anniversary of the Community Mental Health Act of 1963, Doctor, when it comes to the stigma connected to those dealing with suffering from behavioral mental health issues, how far have we come? How far do we still need to go?
We've made progress in destigmatizing mental illness, but there's still work to go. And we also have to understand, as our population becomes more diverse, and we have people who are coming from Eastern Europe, from Latin America, from Southeast Asia, they're bringing their culture with them, as is understandable, and they have different views about mental illness. And we as providers, we have to develop health literacy, we have to develop cultural competence so that we can address those issues and understand the cultural impacts which can become barriers to care. So I think we've done a lot in the United States, but we still have a lot more to do as our society changes.
Thank you, Dr. Perry.
Thank you.
One-on-One with Steve Adubato has been a production of the Caucus Educational Corporation, celebrating 25 years of broadcast excellence. Funding for this edition of One-on-One has been provided by the New Jersey Education Association, Wells Fargo, activists in cooperation with the American Medicine Chest Challenge, the law firm of Gibbons PC, Cohn Resnick, and by New Jersey Natural Gas. Transportation provided by Airbrook Limousine, serving the metropolitan New York, New Jersey area. One-on-One with Steve Adubato has been produced in partnership with St. Joseph's Healthcare System.